Hey guys, in this video we're going to talk about the anatomy of the leg. So you guys know that the leg is formed of the tibia, the bigger bone, and the medial bone, and the fibula, which is the smaller lateral bone. If we try to take a cross section and look at the border and surfaces of tibia and fibula, we'll find that it's triangular in cross section, the tibia. However, the fibula above is quadrangular in cross section. It has 4 borders, and as you reach down it becomes triangular in cross section. Now let's talk about the tibia and fibula and see the borders and surfaces that we have. Like if you think about this as a triangle, so you have anterior border, you have posterior border, and then you have, sorry I meant it here, you have the interosseous border. So the interosseous border is basically going to give attachment to the interosseous membrane, which is going to attach the tibia to the fibula. The same thing will happen with the fibula. If you think about it, you have it as if it's just like triangular in cross section. It's going to have interosseous border, it's going to have anterior border, it's going to have posterior border. Okay, this is going to be the fibula all the way up to down. Now what about this? This is actually something called fibular crest or crest of fibula, which gives attachment to structures, but you don't see it throughout the whole length of the fibula. That's why you get to see it square shaped in above regions here all the way, but as you get down it becomes triangular in shape. All right, now it's very simple that if you imagine that you are holding a triangular shaped a piece of paper, that you orient the one border anteriorly, one border posteriorly, one border to the interosseous membrane, that will give you the 3 borders. Now how can I remember the surfaces of the bones? It's very simple. First of all, the interosseous, you need to know if the interosseous, if let's say this is the right tibia of a patient, okay, this is a right tibia, so the interosseous border, because this is a medial bone, is going to be a lateral border. So the other name of the interosseous border for tibia would be lateral border, and the opposite is true for fibula. Fibula is a lateral bone, so its interosseous border, to make it attached to the medial bone, is going to be medial border. All right, so this is the other name of interosseous borders for both. Now I have anterior border, I have posterior border, I have interosseous border. If I have this, that's gonna give me surfaces. So if this is my right tibia, let's say, this is gonna give me medial surface, lateral surface, and posterior surface. All right, and what about the other bone? It's the same. It's gonna give me medial surface. It's gonna give me, hold on, if this is my right tibia, fibula should be outside, all right, and that will be lateral surface, medial surface, and posterior surface. All right, you just guys orient yourself and imagine that on your own self, and it's gonna be very easy. So the take-home message here, we have medial and lateral borders. Let's see them on the tibia itself. If you guys look at the here, this is gonna be your anterior border. All right, you will have here, this is a right leg, so this is a medial surface. All right, this is gonna be a lateral surface, and then posteriorly this is gonna be a posterior surface. All right, it's all the way up. Now what about the other bone? The other bone, which is our which color? Green, which is our fibula. If you guys look at the fibula, you will also have, this is a right bone, so this is gonna be the lateral surface, and then here you have medial surface, and then posterior you have posterior surface. All right, all the way down. All right, now this is regarding the surfaces and borders of both bones. So we have anterior posterior borders, interosseous border for both. We have medial lateral surfaces, posterior surface for both. I just want to say one extra thing. When we look at the distal end of the bones, it's quite intuitive that everyone knows that lower we have interaction with the ankle joint, and down here we have the tarsals. So you know that you're gonna make a joint here, and so in order for your lower ends to slide over the convexity of the talus, you will have articular concave surfaces in tibia and part in fibula. Now tibia is quite easy. Now as you go down, all the way down, with the tibia being your medial bone, the projection is going to be called medial malleolus, and for the fibula as your lateral bone, the downward projection is going to be called lateral malleolus, and that is easy. Now what I want you to know here, guys, is that actually in reality, or in the practical session, or in the dissection hole, if you hold the fibula, it's going to be so much confusing to orient yourself between the head and the lateral malleolus, because it looks the same up and down. And the head has the apex, it has, this is the head, and you have the neck, shaft, and then lateral malleolus. How will you be able to know it? You need to look for a depression. Can you guys see this circular groove depression? We call it malleolar fossa. Can you guys see? This malleolar fossa, if you put your finger on that, that should be directed posteromedially. It should be directed posteromedially. Again, posteromedially. Once you bring it posteromedially, you will be holding the fibula in anatomically correct position. That will make you to know the borders surfaces, and that will also make you to know the proximal end from the distal ends of fibula. Now what is important in the distal end of fibula, I just want you to remember, if you put your finger here and you know this is for the malleolar fossa, you will find an articular surface, which is, can you guys see this smooth surface? That's gonna be for this down smooth surface, that will be for articulation with the talus, because talus needs to articulate with fibula and tibia. So here, this is going to be for the articulation of talus. And if you go up, you will find a smooth surface and rough surface. The rough surface will be for the interosseous membrane. If you guys look at the fibula from anteriorly, you will find rough surface for interosseous membrane, and that is going to be the other smooth surface is going to be for the articulation with the tibia itself. All right, here. All right, so here you have articulation with the tibia, smooth surface, and another rough surface for articulation with the tibia. Okay, so this is just the things I wanted you to know in the distal end of fibula. Now we have some clinical notes, and during adolescent, guys, because those young kids, or they are growing up, so and because the tibial tuberosity, the epiphyseal growth plate is projecting into tibial tuberosity, it's commonly that we get to see inflammation in that region during the growth spurts, and that is going to give you an area of pain and inflammation and swelling here. All right, so that is what we call the Osgood-Schlatter's disease. All right, and so it's just where you have the attachment of the patellar tendon on the tibial tuberosity, and that is because of the growth spurts that happens at that region. So it's commonly seen during the growth spurts periods, and this is just a clinical note that we need to know, which is related to tibia. Another thing is the commonly seen fracture in the tibia is between the upper 2/3 and the lower 1/3, and that is going to be the weakest point where you get to see fracture in the tibia itself. And for the fibula, commonly we get to see a fracture just proximal to the lateral malleolus, which is like around 2 centimeters above the lateral malleolus. This is going to be the most commonly seen kind of fracture, and that fracture happens with the hyperinversion of the ankle joint and this is just a clinical note related to fibula. Now moving on to the joints, you guys know that tibia and fibula are connected together in 3 places. We have the proximal tibiofibular joint, we have the middle one, and then we have the distal one. The only one that is plain synovial, it's basically the proximal one, and this is a synovial joint, and you guys by now know what do we mean by synovial joint. And there would be kind of sliding, gliding kind of movement between them. And then in the middle and lower tibiofibular, you have fibrous kind of connective tissue that connects them. So that joint, we call it fibrous joint, whether it's middle or distal. What type specifically? It's the syndesmosis kind of fibrous joint, all right? All right, so this is the, it's going to be between who and who? The proximal one is going to be between the head of fibula and the articular facet on the lateral tibial condyle here. So this is head of fibula and lateral fibular condyle. And the middle one is going to be between the interosseous borders. And then the distal one is going to be on the articular facet. You will have an articular facet in fibula. You're going to have an articular facet on tibia, and that is going to be the connection between them, and here you will get to see this fibrous kind of connective tissue. Now it's very important we understand the neurovasculature and what happens as we reach the leg. Now if you guys trace the nerve, you guys know that previously we talked about the sciatic nerve, and once it runs down, deep down, and once we reached the the popliteal fossa, which had the biceps femoris here, and we have the membranosus there, that nerve started to give us tibial nerve and common fibular nerve, because you guys know that this is the fibula and this is the tibia. So as the sciatic comes down to the popliteal region, it will split itself into, like you see here, the tibial nerve and the common fibular nerve, one towards the tibia and one towards the fibula. Now as the tibial one goes down, it's going to take care of the innervation of all muscles at the back. And that is very important because the tibial nerve, you guys, as it runs back, it's going to give you a nerve that is called medial sural. So if this is your leg, all right, if this is your leg, the medial sural will give you sensation in the posterolateral aspect of your leg. Because you guys know when we talked about the femoral, we said that medially it's all taken care of by the saphenous nerve of femoral. And that is the only nerve that reaches down here, and it's also a cutaneous, pure cutaneous nerve. So that was the saphenous nerve. Now as the tibia reaches down here, it's gonna give medial sural, and we call it sural because sural means cuff area. All right, so that is a cutaneous branch that emerges at the cuff area. So it's gonna give the tibial will give you the medial sural to take care of the posterolateral aspect of your leg. And then the other branch, which color? The other branch which is the common fibular nerve, which is actually going toward, if you guys see the yellow color here, the common fibula is trying to reach the fibula, and as it reaches the neck of fibula, as you guys can see, it's gonna split into deep fibular to take care of the anterior aspect of the leg, and it's gonna give the superficial fibular to take care of the lateral aspect of the leg. All right, so the common fibular will split itself around the neck of fibula. Don't forget this information, around the neck of fibula, and it's gonna give you a lateral branch and a branch that goes deep down there. Now if you guys try to think about what happens here, you will find that at this region you had the common fibular. So you guys, the common fibular nerve, all right, is gonna give you a cutaneous branch, and that we call the lateral sural nerve. So that will take care of the sensation above laterally here. Now what about the region that is down here? This is you guys the place of the lateral compartment. If you are on the lateral compartment, it means who's gonna take care of you is the superficial fibular nerve. All right, so if this is my leg, remember, laterally superficial fibular nerve, anteriorly deep fibular nerve. These both were coming from the common fibular. Posteriorly is the tibial, and you guys know that posteriorly, all of posteriorly was your tibial nerve. So look again, the tibial nerve will give you all the branches of the posterior aspect, and it will end at the foot as medial and lateral plantar nerves. This is a very important nerve, the tibial nerve. However, if you look at the common fibular or common peroneal, the old name, common peroneal, it will go toward the fibula, it will split itself at the neck, it will give you a branch to take care of the lateral compartment, and that we call it superficial peroneal. Superficial, you guys, because it was coming from outside and it goes outside. However, the deep peroneal, it goes all the way deep until it becomes anterior to the interosseous membrane. And remember, guys, from the upper limb, whenever we have a nerve that runs in front of the interosseous membrane, we consider it a very deep nerve. So that's why we called it, it's the deep fibular nerve. It's the deep branch of fibular nerve. So this is the deep fibular nerve that once it comes from the common and it reaches deep down there because it wants to take care of the muscles of the anterior compartment, we call it the deep fibular nerve. All right, guys, and I love this actually picture because it gives you color code kind of labeling. It tells you that the green one, which is the deep fibular, takes care of the anterior compartment, muscles anteriorly, and then the two muscles laterally will be the superficial fibular. Superficial fibular in this case is going to be a muscular end sensation of the lateral aspect of your leg, and the posteriorly, you guys know that it's all by tibial nerve, and this is the most important nerve that will continue the journey all the way up until it gives you medial and lateral plantar nerves in the foot. All right. Now, what about the arterial supply? Remember, the nerve, yes, it was from the sciatic. Yes, it was from the guy who came from the back. But the artery, the main blood vessel that was trying to reach down and continue the journey with us, remember the adductor canal and the popliteal area, that was the femoral artery, guys. So the femoral artery is going to take care of everything down. So once the femoral artery, you guys remember, once it comes out of the adductor hiatus and it reaches the popliteal region, it gave you all the genicular branches, and popliteal, it's in Latin means knee, genicular means joint, so it will give you medial and lateral superior inferior genicular branches that will take care of the knee joint. That's fine. Now once we get down, guys, with the popliteal, once you read down, you guys, here at this point your popliteal artery is going to split into two branches. One will become posterior, so we call it posterior tibial, and one will come from the interosseous membrane. It has an opening into interosseous membrane, and it will emerge to the anterior compartment, becomes deep anteriorly, and that is going to be the anterior tibial artery. All right, so the one from the popliteal artery, I hope I didn't say nerve by accident. So the popliteal artery, at this point, once we reach the interosseous membrane, we will have a branch that goes posteriorly, we call it posterior tibial, and another one that comes out from the interosseous membrane to reach the anterior compartment, and that's going to be the anterior tibial artery. Now what about the fibular? Great. The fibular artery is actually a branch of posterior tibial. It's not a branch of popliteal, it's a branch of posterior tibial. The posterior tibial was generous enough. It told itself, okay, fine, I have a posterior branch and I have an anterior branch, and the fibula is very poor. No one give her a blood supply like the sciatic. The sciatic nerve, it gave common fibular, but here the story is different. Posterior tibial was generous enough to give the fibular or peroneal, so I'm gonna give a branch that goes to the fibular side, and I'm gonna call it a fibular branch. That's why, guys, sometimes this part here, if you guys look at this part here, sometimes they call it the tibiofibular trunk. Sometimes. Mostly they say it's a posterior tibial, and then they would tell you the fibular is a branch of it. But sometimes they say this is a tibiofibular trunk, because after some time, after very small distance, it's gonna give you a posterior tibial and fibular. All right, because that was one of the questions that used to confuse the students. The story is different, guys. Now, the blood supply story is different than the innervation story. The innervation, it was sciatic, and in the popliteal area, it gave me common fibular and tibial. And the common fibular splitted at the neck of fibula to give superficial fibular to the lateral compartment and deep fibular to the anterior compartment. However, here in the blood supply, the femoral nerve, artery, when it reached the knee joint, the popliteal area, it gave popliteal artery, and when it came down, it gave anterior and posterior tibial arteries. The posterior tibial itself gave us the fibular artery. All right. All right. So this is the blood supply. Now, if we try to see those things in a real cadaver picture, if you guys look at the big vessel, the has a big lumen that is in the popliteal region, this is going to be your popliteal artery. And popliteal artery, once it comes down here to the lower border of popliteus muscle, it's going to give you a branch that runs all the way down, and we call it the posterior tibial artery, and another branch that gets down and disappears, and it appears in the anterior compartment. Now, what about this who is appearing here? This is the fibular artery, okay? The fibular artery, which is a branch of posterior tibial artery. This is the one that comes from the posterior tibial artery, and this is the common trunk, basically. So the common trunk here, the popliteal artery, it's gonna give you a common trunk. Sometimes they call it tibiofibular trunk. It will give you posterior tibial goes all the way down, and then the fibular is gonna come, whether you wanna say it from the posterior tibial artery or from the common trunk, to go all the way to the fibula side, and then you will have the anterior tibial artery coming proximally here to go and disappear, and then it reaches the anterior compartment. All right. We do have nerves, but it's kind of reflected here. So you guys know that the tibia nerve is in the middle here, and the common fibular is lateral. If you guys trace it from down, you will find that this is the tibia nerve. It's the nerve that comes straight down, but it's kind of, you know, going there with the part they are trying to put it on the side to see the blood supply. But anyway, this is the tibia nerve, goes all the way from the popliteal region here. As you can see, this is the tibial nerve, and once you trace what happens to the common fibular, you guys see that the common fibular was coming in the medial border of biceps femoris muscle, and as you reach the neck of fibula, you will split yourself into a nerve that reaches the lateral compartment. You call it superficial fibular nerve. It gives innervation to the two muscles of the lateral compartment, which is fibularis longus and brevis, and also sensation here. And then another nerve which goes deep down there, and it appears here in the anterior compartment, and that is the nerve is what we call the we call it the deep fibular nerve. Actually, it's another name is anterior tibial nerve, but no one is using this nerve because it's a bit confusing. They would like to say tibial for the posterior one, tibial, and that's it, and they would like to say for the anterior one, deep fibular nerve. Sometimes they would say, no, this is anterior tibial, and the tibial, once it becomes posterior compartment, we should call it posterior tibial nerve. Anyway, posteriorly you have tibial nerve, anteriorly you have deep fibular nerve, laterally you have the superficial fibular nerve. All right, if you look at this picture, you will see here the yellow and red. The artery is the anterior tibial artery. Remember, once it came from the interosseous membrane, it became anterior tibial artery, and then the nerve is the deep fibular nerve or deep peroneal nerve. Laterally, remember that was around the neck of fibula, it gave us these two, that was common fibular, and then laterally you have the superficial fibular that gives innervation to the lateral compartment. All right, so this is